Hi, this is Dr. Wright. This is part of the Lung Pathology and Easy Bite series. This section involves discussion of granulomatous inflammation, and this specific session addresses granulomata which are randomly distributed and due to fungal organisms. So the learning objectives are firstly to learn the definition of dimorphic fungi, to learn the distribution of the various fungi throughout the world, and to be able to identify the various fungi using their morphologic characteristics. First of all, the definition of dimorphic fungi. These are fungi that can switch between yeast and hyphal forms or mold forms depending on the environmental condition. You find the mold form or the hyphal form at 25 to 30 degrees centigrade, whereas you find the yeast form at 35 to 37 degrees centigrade, which is why in human granulomatous lung disease you will find primarily the yeast forms. Here's a little mnemonic that makes this easy to remember: mold in the cold and yeast in the heat. The common dimorphic fungi in Canada and the US are Histoplasma, Cryptococcus, Coccidioides, and Blastomyces, and I'm going to concentrate on these four. There are other dimorphic fungi. This is a distribution map which shows the distribution here of Histoplasma, Blastomyces, and Coccidioides. Histoplasma is seen here in the St. Lawrence River Valley, the Mississippi River Valley, and the Ohio River Valley. So if you're a hiker, that's where you'll find associated with histoplasma. Blastomyces is seen again in the eastern and central US and going up into southern Manitoba. So if you hike in these areas, Blastomyces is a pathogen. Coccidioides is a hot weather fungus which is found generally in Arizona and New Mexico. And if you hike in the desert, Coccidioides is the fungal organism that you'll be associated with. There are other fungi obviously throughout the world. This map just shows the US, South America, and Africa rather than Europe and other Asian areas, but the dimorphic fungi are seen throughout the world. Cryptococcus, there are two basic forms: Cryptococcus neoformans, which can be seen in immune-compromised patients, and Cryptococcus gattii, which can be seen in immune-competent people, particularly those that like to hike in rainforests. What I've done here is the upper picture is taken at the same magnification to show the relative size of the organisms from organism to organism, whereas this lower photomicrograph shows the organism at the higher power so that you can see its characteristics. Histoplasma is found in soil enriched by bird and bat feces. So if you're a cave hiker, then histoplasma is in your future. The organism tends to be ovoid, as in shape, as you can see here. It's quite small, 2 to 4 microns. And if you find it budding, the buds are narrow-based. Appropriate stains for the identification of histoplasma are periodic acid Schiff, or PAS stain, which identifies the mucoproteins in the wall, and the silver stain, gram-methenamine silver. These are gram-methenamine silver stained photomicrographs. Cryptococcus is found in pigeon and bat feces and is also found in rainforests. The cell wall is about twice the size of histoplasma, from 3 to 8 microns. It has narrow-based budding and is characterized by a thick mucinous capsule, which can be some additional 3 to 5 microns in diameter. Some forms are acapsulate, but most of them are capsulated. You can take advantage of the capsule because it stains with mucicarmine. Occasionally, one can find melanin within the wall of the organism, and this can be accentuated by a phantanomasson or another melanin-type stain. The usual fungal stains are quite important in the identification of the organism. So that's Cryptococcus. This is Blastomyces. Again, it's a big organism, 8 to 15 microns. It's characterized by a very thick cell wall. Often the cell wall is slightly refractive. When you find it budding, the buds are broad-based And again, the appropriate stains are PAS and GMS to identify the organism. Coccidioides is the largest organism that one can find. It's present in hot, dry climate, so you can find it in Arizona, so-called valley fever. The spherules are quite large, 10 to 80 microns, as you can see here. And on a higher magnification, you can find the presence of endospores, which are about the same size as histoplasma. The endospores are obviously within the spherule, and when the spherule breaks, it releases the endospores, which go on for further infection. The appropriate stains, again, are PAS and GMS to identify the organism. So the pathological features of fungal infections, they're randomly distributed within the lung lobules. They can involve anywhere in the lung. They can involve the interstitium, the airways, and the air spaces. Very rarely, they can even involve the vessels. They can be necrotizing or non-necrotizing, but necrosis is very common in fungal infections. And they have a wide range of associated inflammation, from none to a pneumonic infiltrate to the granulomata that we're talking about in this session. I don't want to give you the idea that all fungal infections are granulomatous, so I'm going to illustrate some of the wide variety of inflammation that can be associated with the fungal infections. This is histoplasma, and this is a histoplasmoma, where there is a dense fibroconnective tissue capsule which surrounds this area of necrosis. And if you stain this with a silver stain, you could find little collections of remnant histoplasma organisms. Histoplasmosis does not necessarily form granulomata. In this case, there are large collections of rather foamy macrophages, which at a higher power have a funny granular appearance. And when you do a silver stain, you realize that the granular appearance is due to the presence of histoplasma absolutely stuffing these macrophages. Here's cryptococcosis, and in this case, the inflammatory reaction is really quite limited. You can see that there's perhaps a little collection of macrophages here, and when you stain this collection of macrophages with mucicarmine, you find Cryptococcus organisms. You can also find areas of rather vast necrosis in Cryptococcus. You can find a mnemonic infiltrate in Cryptococcus, and there can be so-called gelatinous consolidation where the lung has almost been replaced by a sea of Cryptococcus organisms. So there's a wide variety of inflammation with all fungal organisms, and when you're evaluating the lung for infection, it's a good idea to keep that in mind. Blastomyces is the most inflammatory of the fungal organisms, so that there can be actual large areas of necrosis, and the necrosis can be neutrophilic in type. In this slide over here, there's a palisade granulomatous reaction with some multinucleated giant cells, but in this slide here, it's largely neutrophilic. The arrows point to little blastomyces organisms which can be identified. Here's coccidioides. So you saw the dense granulomatous reaction of coccidioides, and here is one where there is actually marked necrosis, with along the periphery of the necrosis poorly formed granulomata and multinucleated giant cells. In this case, coccidioides has a definite granulomatous reaction with relatively well-formed granulomata, and when you look at these granulomata, you can find the coccispherules with the endospores present within the spherule. So our learning points of this session were to understand the definition of the word dimorphic pertaining to fungi, to understand the worldwide distribution of common dimorphic fungi, and to understand the morphology of the common dimorphic fungi, and finally to understand the pathologic patterns which are involved in infection with the dimorphic fungi, and to understand that although they are part of the granulomatous differential diagnosis, they might not always be granulomatous. Here are your questions. Here's question number 1. The answer to question number 1. Question number 2. The answer to question number 2. Thank you. I hope you've enjoyed this session on granulomatous inflammation, and specifically the dimorphic fungi, and as always, your comments are gratefully received.